helping make your life easier. Moms Every Day.
Lots of people with asthma think that they can't exercise, that it will do more harm than good. Dr. Petra Razdan with Allergy, Asthma and Immunology Associates is here to talk about asthmatics and how they can actually benefit from some sort of activity. And nice to see you, Doctor.
Nice to see you.
Yeah, so can allergies affect your ability to exercise?
Absolutely. A patient with severe hay fever can have profound nasal congestion, and they'll have actually a sensation of shortness of breath when they're exercising outside. In patients with asthma that are allergic, that's a double whammy. It can definitely impair your ability of exercising. I do tell all my asthmatic patients to do continue, because if they can't exercise, then I have not done my job properly.
So if you have allergies and you are exercising, especially like hay fever season or something like that, you might have red eyes, trouble breathing, things like that?
Absolutely. Specific if you have allergen-induced asthma, I would definitely pre-treat with your albuterol before you're going to do your run outside. Make sure that you've seen your allergist or your primary doctor prior to that high pollen count season to make sure your asthma is under control before you expose yourself to that.
So asthma attacks, what would be some of the symptoms?
Coughing, wheezing, chest tightness, dizziness, and you can actually have a syncopal event, pass out.
Okay. So how do you treat this? If a kid out there wants to do sports, how would you do that? How would you approach it?
Well, first I would just establish the severity of his asthma. First of all, do a breathing test if the child is of age, like a spirometry, and you can also check their airway inflammation to make sure their airways are not too inflamed. And then establish the proper medications. If they have intermittent symptoms, you can try Singulair and then just pre-treat with albuterol about 15 to 20 minutes prior to the physical activity. And if they're having more persistent symptoms, then they might need a daily inhaled steroid.
Now, for those of us who just want to exercise, and if you're dealing with allergies or asthma, can it actually be good, to get some kind of physical activity if you have that condition?
Absolutely. Physical activity is excellent, and I really want my asthmatic patients to feel that they can exercise all the time. A lot of my patients actually run the Lincoln Marathon, and that's amazing. That just means that they're taking their medication, their asthma is under control.
What do they do then for treatment?
Inhaled steroids, single combination or in combination with a long-acting bronchodilator like Advair or Symbicort, etc. Singulair is a great combination if it's allergen-induced asthma. And then having your rescue inhaler to treat right before you exercise. When you exercise, your airways can be kind of thick, and you can have wheezing and coughing and sensation of shortness of breath.
So just be smart about it.
Absolutely.
Okay. Thank you so much, Doctor.
Thank you.
And for more information on Allergy, Asthma, and Immunology Associates, visit momseveryday.com or download the Moms Everyday app.
Visit Moms Every Day online or on the go through our Moms Every Day app. Download it today to find local solutions for you and your family.